Okay. Okay, when you're ready.
Too often, we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest accomplishment, or even the smallest act of caring, all of which have the potential to turn a life around. Leo Biscaglia. Good morning. My name is Hunter Epps. Improper communication between a healthcare provider and patient is vital to the patient's well-being, both mentally and physically. But recent studies have shown a decline in communication skills between healthcare providers worldwide, leading to communication barriers affecting patient satisfaction and well-being, causing malpractice suits, and a deeper understanding into the importance of professional interpreters for the limited English proficiency patients. All this and more has led me to seek the answer to the question of, how has communication barriers affected patient satisfaction and well-being? Over the past couple of decades, the quality of face-to-face communication in the field of medicine has been decreasing, impacting the way that a healthcare professional communicates with his or her patients. A healthcare professional is not just a doctor, but rather any individual who has an active role in diagnosing, treating, and caring for patients with abnormalities. Patients expect the best quality communication between them and a healthcare provider. In this diagram, we could see the layout of patient-centered care, or the care expected by patients, such as respecting the patient's values, along with providing a family welcoming environment. But most importantly, patients expect full transparency when it comes to their health situations, with emotional and physical well-being being their top priority. This proves that patients expect the best quality of care between them and a healthcare provider. However, the lack of inter-team communication can form barriers affecting the communication between a doctor and a patient. For over a decade, the importance of communication between healthcare providers has been a topic of interest for Arthur Bochner and Clifford Kelly at the National Communication Association, a non-profit society founded to show communication through humanistic, social, scientific, and aesthetic inquiry. Through Bochner and Kelly's research, it was found that individuals that have exceptional interpersonal communication skills are able to set and receive learning goals, collaborate, and adapt to situational changes better. In other words, being competent in interpersonal communication or teamwork is an important step in achieving the excellent communication needed to give patients the quality of care they deserve. As is imaginable, having a difficult time communicating with one another is bad enough. But when it comes to communication barriers affecting patient satisfaction and well-being, it can affect the patient's psychological and physiologically. In a recent study done by researchers at the University of Klaipėda Public Health, which is a multidisciplinary educational institute in Lithuania focusing on research, found that proper communication can impact a patient's level of care and well-being. In this research, it was found that good communication skills can lead to better patient enablement or the ability of a patient to understand his or her own health situation, leading to a more optimistic outlook on their health situation along with a more intensive drive to get better. Without proper communication, a doctor could wrongfully diagnose the patient, and the patient will be left confused and unable to properly follow their course of treatment, leading to psychological and physical effects causing further health conditions. Furthermore, a recent study done by David Harrison, a field linguist, author, advocate for the documentation and revitalization of endangered species, studied the Aka language of the Arnautu Pradesh and found that language shapes human experience, our very cognition, as it goes about classifying the world to make sense of the circumstances at hand, showing that improper communication between a doctor and a patient can lead to a negative mindset affecting the psychological well-being of the patient. In addition, a recent study conducted by Robin O'Halloran, a speech pathologist studying neurogenic communication in acute rehabilitation and communication healthcare settings, found evidence that explained environmental factors and the influence on communication between healthcare providers and the patient. This study found that proper communication between patients and the healthcare providers can increase physical health with the right diagnosis, proper treatment, along with the patient adhering to this treatment, improving self-care, and increasing the patient's health beliefs. Not only do communication barriers affect the psychological and physiological aspects of the patient's well-being, but improper diagnosis and treatment can lead to malpractice suits. Medical malpractice is defined as the improper negligent treatment of a patient by a doctor, dentist, nurse, pharmacist, or any other healthcare professional. In a recent analysis of malpractice suit payouts, it was found that as of 2012, there's been a payout every 43 minutes totaling just over $3 billion. Even though patients and doctors are not directly involved in the malpractice suit personally, patients can still experience negative psychological effects such as increased anxiety and stress. Medical malpractice can lead to a negative perspective on the healthcare industry as a whole and increasing the cost of malpractice insurance, leading to more expensive medical treatment. The effects of malpractice can cause some patients the inability to visit the doctor and receive proper medical treatment. Communication barriers that affect patient satisfaction and well-being extend much further than the lack of proper inter-team communication or doctor-patient communication, but rather to the problems faced every day in the field of medicine, such as the variety of different languages patients speak, along with healthcare professionals being unable to properly communicate with these patients. A recent study of the world's vanishing voices by Russ Reimer at the National Geographic Society, a nonprofit scientific educational organization, found that of the world's 6,500 larger languages, 78% of individuals speak 85 of the world's largest languages, including English, Spanish, and Russian. The study also found that of the world's 3,500 smaller languages, there are only about 8.25 million speakers. In other words, when it comes to the languages of the world, there are many individuals that speak many different languages, leading to barriers that decrease patient satisfaction and well-being. Therefore, there is a growing need for professional interpreters for the limited English proficiency patients. With all these communication barriers affecting patient satisfaction and well-being, what can be done to fix the issue and help better patient satisfaction and well-being? Well, communication between a doctor and a patient can be stunted when the patient is not completely open or honest about his or her situation. To aid in fixing this issue, patients have to be comfortable and open with a healthcare provider, while doctors should take more time explaining the situation to the patient and making sure they understand. Therefore, initiatives will need to be put into place to teach the public on how to take charge of their situation, while having programs to teach healthcare professionals how to properly communicate with these patients. Now, this solution does not come without its fair share of limitations. For instance, finding the funding needed to provide these educational initiatives might be hard to get, while getting patients and doctors to participate in these programs could be challenging due to busy schedules or just a lack of interest in learning the new topic. In conclusion, there are many communication barriers affecting patient satisfaction and well-being, ranging from the lack of inter-team communication to not focusing on patient-centered care. These are just some of the communication barriers and their effects on modern medicine that have caused a decrease in patient satisfaction and well-being. Thank you.
Okay, so let's talk about a couple of questions here. What information did you need before you began your research, and how did the information shape your research?
Before I began my research, I knew from taking previous classes that there are barriers to communicating properly with the patient and the healthcare professional. And through that, I was able to come up with the question of how has communication barriers impacted patient satisfaction and well-being, because I knew that when communication is not good enough between a professional and a patient, the patient could be left confused and not knowing exactly what to do with their treatment, not knowing what medication to necessarily take, and causing psychological or physiological effects.
Okay, explain the level of certainty you have about your conclusion or solution.
So my solution was to provide educational initiatives to teach patients how to take charge of their situation while teaching healthcare professionals how to properly communicate with the patient. If we were able to get over these limitations, such as the financial side of it and the lack of interest patients and doctors would have in taking these classes, or the busy schedules that both parties have, we would be able to teach people how to, or teach the public how to take charge of their issue while teaching doctors and doctors how to properly communicate with these people, leading to a better well-being for the patient, healthier patients, and all around just a healthier community.
Okay, thank you. You can clap now.